I had early breast cancer, picked up on screening in June 2010 and treated at my local hospital. I'm a retired doctor, too old for clinical experience in modern chemotherapy, but I have past experience of seeing people suffering with severe infection, sepsis, and witness poor outcomes for some patients. I started chemo, FEC 75x6, in September 2010. There was a very good hour-long induction session with one of the chemotherapy sisters who gave me a heat card and really encouraged me to seek early help if I felt unwell, either by phoning the unit or going to hospital. I was also given a short printed sheet of advice on how and when to call for help. It was day 9 of the cycle. I went to see my GP in the morning because I'd had a very sore mouth overnight. He prescribed medication, but he also took blood to check the white cells, wondering if the sore mouth was an indication of neutropenia. Well, I was a little taken aback because apart from the sore mouth, I felt well. I had no temperature. Later on at home, when I was idling on the laptop, I developed this spasmodic low back pain and marked sudden shaking. I wasn't feverish, hot or cold, but I did feel peculiar. So I phoned the chemo unit and was advised to come in for an urgent blood test. I explained that I'd had one taken that morning. Well, the nurse found the results, which showed I had very low white cell count and severe neutropenia. So I was told to urgently get myself to the nearest A&E with my heat card. The nurse said she would let them know to expect me. Well, my husband drove me in. I produced my card at reception. The receptionist turned it over in amazement, saying, "Well, I've never seen anything like this before." Told me to sit down in the waiting area. To my relief, she emerged immediately from the office and I was marched briskly to the nursing station with the card. I was called straight through to one of the assessment cubicles and the nursing and medical staff there whizzed into action. In what seemed about 10 minutes, I had my blood and blood cultures taken by the A&E SHO. Within half an hour, I was seen by the duty medical registrar and given antibiotics and further medication. You know, I was lucky. I survived a potentially life-threatening infection. You know what I've learned from this experience? Do phone your chemotherapy unit. And do use your heat card or helpline card. Don't phone the GP first. That causes delays. And don't delay in phoning your symptoms through to your chemotherapy team. And don't ignore symptoms.